Good morning. Today we have Dr. Kimberly Coleman, registered nurse and doctor of acupuncture, to tell us about the best foods to eat for autumn.
Good morning, everyone. Thank you so much for being here today. I'll just give a brief introduction of myself. My Chinese name is Jimbo Li. I had the opportunity to study in China for 4 years while I got my PhD there. I've also been a registered nurse since 2003 and a licensed acupuncturist since 2016. And in the United States, there's a national certification through where I have a diplomate of Oriental medicine. So I also. Oh, yes, thank you. My mic isn't on. Thanks. Is that better? Yes, great. Shall we start over? Got it. Okay. Well, registered nurse, licensed acupuncturist, and I had an opportunity to study in China, where I got my PhD in Chinese medicine. So some disclosures to start. The information contained in this presentation is just for educational and informational purposes. Please don't try to use this information to self-diagnose or treat. I'll be happy to see you outside of this setting if you have further questions. And the content of this presentation does not represent Johns Hopkins, Suburban Hospital, or their affiliates, as I'm also employed by them. Some objectives that we have today. The first part of the presentation will be some practice of Tai Chi movements together. And those movements will support us through the fall season. Then I'll introduce some TCM theory, acupuncture, and its modalities. We'll summarize some fall dietary suggestions. We'll discuss preventing overeating and some self-care for the holiday season, and also some cold and flu remedies that you can do for yourself, both healing sounds and acupressure. And then there'll be some question and answer time at the end. So we'll start with some Tai Chi. If I can invite you to join me in standing.
The first thing that we always want to do is to rid any excess from the body. So we're just going to bounce and let the arms hang and shake. Yeah, you could even lift up on your toes and fall down onto your heels and feel the vibration through your body. So this is called shaking. And then we're going to add some sighing, closed mouth sighing. So we'll take a deep breath in and just sigh. Yeah, just let the awkward be awkward. Shaking and sighing. Deep breath in. That loud, audible sigh. A little more. Shaking. Getting rid, letting that go. Now we're going to do a little bit of rocking. So this is just swinging the arms from side to side. You can lift up your heel and rotate at the waist. Yes, this is rocking. Let your arms relax, and they can even hit your sides on each side. And now we're going to add some knocking. So the lung channel starts just below the clavicle, near the shoulder here on both sides. So as our arms swing, we're going to just gently tap with an open palm the front of our shoulder. This is the knocking part. So be sure not to, lift your heels. Rocking and knocking. Good. So this helps to activate the lung channel that starts here at the shoulder. And we'll talk more about how that's aligned with our immune systems later in the talk today. Okay, so the next couple breaths, we'll just slow that down. You can relax the arms and come to stillness. Great. Now we're going to tap the lung and large intestine meridian. So as I said, the lung meridian starts here in the shoulder. And it goes down to the thumb. So we're just going to gently tap with an open palm along the lung meridian. And then we're going to the large intestine goes from the pointer finger up the shoulder. So we're going to tap down the lung meridian and up the large intestine meridian. Make sure you hit the back of the shoulder. Down the lung and up the large intestine. One more time, down the lung, and then we'll do the other side, up the large intestine. Good. Now we'll do the left side. All the meridians in the body are on both sides, so we don't want to neglect one side or the other. Down the lung and up the large intestine. All of the yin meridians, we want to tap down, and the yang meridians, we want to tap up. One more time. Great. So this is really activating those two channels on the body. We'll just take one cleansing breath now that we've shaken loose some things. So we'll inhale with our palms up. And exhale, you can imagine a white light just washing over your body. The color of metal in the fall is white. So inhale, palms up. And exhale, white light bathing your body. Great. One more time, inhale. And exhale. Super. So then the next movement we'll do is called white crane soaring. So with this, it's also going to be an inhale. The palms are down. And as we exhale, we're going to bring the thumb and forefinger together in this mudra and exhale. And you can imagine that you're actually a white crane soaring. So your body might rock forward on the inhale and back on the exhale. Soften the knees, relax the shoulders. Inhale and exhale. Inhale and exhale. One more time. Inhale and exhale. Great. And we'll do one more cleansing breath. In and out. And the last Tai Chi movement is called open the bow. This is a little more complex. We're going to spread our feet apart in what's called the horse stance, or if you can imagine like an arch bridge between your legs. The toes can be pointed out just slightly so that you don't put any pressure on your knees. And we want to relax the knees, let our pelvis drop. And the open the bow, we're going to make an L shape with our thumb and forefinger. Again, that's the lung and large intestine channel. And we're going to spread open the bow. And our other hand is going to be here near that lung 1, lung 2 spot. And you want to really stretch from the elbow to the fingers. Feel the activation of the channels. Great. And then exhale. And we're going to do the other side. So with our, yep, great. And you can have your palm facing forward. Good. So the heel of the hand is down. And that L, you're looking right at it. Good. And the left hand is up here by your shoulder. So we'll do this a few times. Inhale as you close. And exhale as you open. Inhale. Exhale. Inhale. Exhale. Really press and bend the knees. Relax the body. Inhale. Soft breaths. You can let the shoulders drop down. Last time on both sides. Inhale. Exhale. Inhale. And exhale. Great. And we'll drop the arms down and bring our feet together. And just notice, just take a minute to go inside your bodies and notice any sensations that you may feel. Maybe some tingling in the arms. Some more awareness of your legs. And we'll take one more cleansing breath in and out. And we'll bring the palms to the low abdomen, the left hand first and the right hand over top. And just take a few breaths here. This helps to seal the work that we've done into our bodies. Thank you. You can have a seat. How did that feel? Any feedback from the audience?
That was my first time. That was very interesting.
Great, great. There's a Tai Chi teacher here at the Friendship Heights Village Center. He teaches 6-week sessions would encourage you to sign up is on Mondays and Tuesdays, and you can get more information at the front. His name is Nick. It's excellent. So now we'll talk a little bit about traditional Chinese medicine. There's this concept of oneness, and then from that oneness came the yin and the yang. And the yin and the yang represent different aspects in nature. So yang represents heaven and the masculine, our rational thought, things that are hard, the light, the sun, fire, while yin represents the opposite, the earth, the feminine, the emotional, things that are soft and yielding, the feeling of heaviness, the moon, and water. And this yin and yang also have relationships with one another that's dynamic. So there's movement and stillness, and this reminds us of the impermanence of life and things in nature. They also create some balance and harmony as they mutually support one another. And the last thing is a concept of building and storing, which are in opposition to one another. So there's yin and yang, and it's not static. There are different ways that they interact. So in Chinese medicine, it's believed that to regain balance in the body, that we need to have a balance between the internal organs of our body and the external environment, which includes 5 elements: wood, fire, earth, metal, and water. These are the 5 elements here. So from that oneness and yin-yang comes the 5 elements. And we'll talk about the metal element today as it relates to the fall season and also our lung and large intestine. So these 5 elements also interact with one another in 2 different cycles. One is a creation cycle and one is a destruction cycle. Just like the seasons of the year, we have spring where everything's budding up, and now in the fall we see the leaves turning and falling to the ground. So the control or destruction cycle, you can see here that metal is controlled by fire. So you can think of that like that, how fire might melt metal. And then a metal controls wood, so you can imagine like a metal axe chopping wood as the way that we can remember those relationships. And then the generating cycle, earth generates metal, so you can imagine deep within the earth the mineral ores that we find, so that earth really creating the metal deep in its core. And then metal generating water, you can imagine how lots of times on metal surfaces water might condensate. So in that way, it's generating water. And then these 5 elements again correspond to the times of year and the seasons. So the metal element corresponds with the fall, and it goes along with inspiration and elimination. And we'll talk a little bit about this more later, but we receive inspiration from the heavens, let's say, through our lungs as we inhale, and we eliminate what's not needed through the colon, or the large intestine, which is the second organ that is associated with metal. And again, inspiration and grief is another emotion that's associated with the metal and the fall season. This idea of letting go is often, and the lungs are associated with grief. You might think back to a time that you were quite sad and over the loss of someone, and we tend to round our shoulders, and our bodies aren't able to breathe as effectively, right? Sometimes we're even crying so terribly that we can't breathe well, right? So the lungs really help to open and release that grief. And then the positive emotion is the inspiration that comes as we take big breaths in. So TCM diagnosis is composed of 8 different principles. You can see them here. There's a yin and yang. So when a practitioner of Chinese medicine is assessing a patient, we would see, is there more yin or is there more yang in their body or in the condition that they're suffering with. We also would look to see if there's more excess or more deficiency. And these aren't necessarily directly associated with yin and yang. There can be an excess of yin, or there can be a deficiency of yang. So we're going to evaluate that. Also more cold or more heat. And then is the condition internal or external? So these are the 8 principles that we take into account as we're diagnosing a patient. There's also what's called Zangfu organ diagnosis. So Zangfu is the Chinese for the organs in the body. The Zang are the yang organs, so that would be the large intestine for the metal element, and the Fu are that would be the lung, and the Fu are the hollow organs in the body. So everything from our mouth down through our digestive system, they're hollow, right? So because the food passes through. So those are the Fu organs in Chinese medicine, and that's the colon during this metal season. And then there can be pathology along the channel itself. So if you have a frozen shoulder, let's say, then we would treat the large intestine channel as it passes through the shoulder. And then I'd like to share a little bit about several TCM modalities. The first one that most people know about is acupuncture, but there are even several types of acupuncture. The first is auricular acupuncture that's limited just to the ear here, and can be quite powerful as the ear is a hologram of our bodies. So you can imagine the lobe of the ear, if it was a tiny baby curled up, that was the child's head, and the spine wrapped around the outside of the ear, and then the internal organs are represented on the inner aspect of the ear here. So we can choose points related to the pathology that's going on with the patient by just using the ear. There's also facial acupuncture that can be helpful not only cosmetically, but also for things like Bell's palsy or stroke, where there's been paralysis on one side of the face. We would actually needle the face to strengthen the muscles and activate the nerves there to bring more balance. There's scalp acupuncture also, which is just like the ear, also limited just to the scalp. This is one of the safest types of acupuncture because our skull protects anything soft underneath. So the needles are inserted very shallowly and at an angle, but it's also very powerful because just like the ear is a map of our bodies, the scalp is also, we sort of treat it based on the structures inside the brain that control different areas. There's a motor line, a sensory line. There's areas that reflect our arms and legs, so we can needle those areas on the scalp to affect our extremities without having to needle a painful area directly. And then one of the modalities we use with acupuncture is called electrical stimulation. This is a very gentle current that's passed through the needles using little alligator clips, and it just strengthens the stimulation of the needles. It's not painful, just feels like a gentle pulsing sensation in the body. And this helps to improve the effectiveness of the treatment, especially for painful conditions or for something like a stroke patient where they've lost sensation or movement in a limb. This is a video I'll show. It's just 3 minutes.
All common conditions that doctors say can land people in the emergency room. But one local hospital is offering patients a new option to eliminate pain. Mary Stoker-Smith explains it's based on a practice that's thousands of years old. It's a place where
the typical day is that nothing's typical.
And inside,
there's some days where we see more minor cases, and some days where we have people that need full resuscitation.
No matter the day when someone walks in,
If anybody presents to the emergency department with what they consider an emergent condition, we will evaluate and treat them.
but at the Aurora West Dallas Emergency Department, traditional treatment is being turned upside down with traditional Chinese medicine.
Acupuncture has been around for thousands of years.
It's been less than 2 years this ER has offered the alternative.
I was skeptical. I wasn't sure. I knew of the practice, but I didn't know how it would work.
It's a natural, non-pharmacological way to reduce pain.
That means no medicine at all.
This one is one of the most common relaxing point that we use here.
An option emergency room doctors want for their patients.
We have a real problem with narcotic opiate abuse and addiction in this country.
We are currently in the throes of a opioid crisis.
It's just great to have an alternative to prescribing narcotics for some of these conditions.
Conditions that are all too familiar in the ER.
Pain is a very common presentation to the emergency department.
I was just nauseous and pain head to toe and pretty much in fetal position.
Barbara Orban opted for needles over narcotics during her hospital visit.
And I was like, absolutely, whatever it takes to get rid of this pain.
Even she admits.
I was like, what? You can't possibly tell me that sticking needles in my body is going to take away this pain that I have.
Hours later,
They hadn't given me anything other than fluids and the acupuncture. And I walked out 2 hours later, it was unbelievable. Unbelievable.
doctors know acupuncture won't fix everything.
There are some cases where it's appropriate that we do use opiates or narcotics to treat pain.
But are glad to have an atypical option
The benefits are many.
in a place where nothing is typical. Mary Stoker-Smith, Fox 6 News.
Aurora says so far, more than half the patients offered the alternative have tried it.
I was in an accident a few years ago and was treated with acupuncture. I'm a firm believer in it. It does amazing results, has amazing results. So, yeah.
Interesting.
Good for them.
Definitely another option.
Yeah.
Well, we want to check in.
So acupuncture is obviously helpful for pain, but it's also helpful for lots of other conditions. The World Health Organization has recognized this list of diseases, symptoms, and conditions that have been shown in controlled trials to be treated effectively with acupuncture. And it's a very long list, but I want to focus on the ones that are applicable for this time of year, the fall season, that are related to the lung and large intestine. So respiratory system disorders like sinusitis or rhinitis, the common cold, even tonsillitis, bronchitis, or asthma. Things like conjunctivitis, which is in the eye. And depression, as it's associated with the grief that we may be experiencing in the fall season, or that's more easily released in this time of year. So acupuncture needles were originally made of stone and animal bones. You can see some examples here. And then there were 9 types of needles that were described in the classical text. You can see images of those here as well. Today, we use sterile, single-use needles, and you can see that the size varies, and that depends on which part of the body that we're using. It's a large part of our training, which size needle and the angle that it will be inserted into the body based on the position, where the acupuncture point is located. So the needles are actually smaller than a human hair. So you can see this syringe with a needle that would be used to give an injection, and how many acupuncture needles can actually fit inside of that. So they're quite small, and most people would say even painless when they're inserted. During the acupuncture treatment, the needles are retained for 30 minutes in the body, and once they're inserted, you really don't feel them at all. Maybe there's a sensation of heaviness or a gentle aching at that site, and that's actually a good sign. It tells us the body's responding to the energy that's there. So how does acupuncture work? One theory is that it stimulates the peripheral nervous system, which then communicates with our central nervous system in the brain. And then our brain releases chemical mediators and hormones that affect our pain response and also other biological processes. From a Chinese medicine perspective, we would say that the pain is caused by this unsmooth flow of qi, and that the needles are helping to smooth the flow of qi, thereby releasing the pain. So when the qi and the blood aren't flowing smoothly in the body, there's pain. Another treatment that we often use after the needles to help extend the length of the treatment, or for folks that might be still afraid of needles, are ear seeds. So these are seeds that are applied with a small adhesive to the ear, and that applies acupressure to the point on the ear for a long period of time. They can stay on for 3 to 5 days or until they fall off, and that can help to extend the effectiveness of the treatment over time. So at the acupuncturist office, they're going to do some inspection and also listening to know what your complaints are, but also listening to the sound of your voice, and then doing an intake, and then palpating the pulse, which we'll talk about in a moment. So these are 4 aspects of the Chinese medicine diagnosis. In Chinese, it's called Wang Wen Wen Qie, and this stands for the look, listen, ask, and palpate. And we'll go over pulse and tongue diagnosis next. So some things that we look for when we're observing a patient, even as they enter the office, as their posture, their gait. There are 4 body constitutions in Chinese medicine, so we also take that into account. There's some facial diagnosis that can be done if we see some different colors in different parts of the face, maybe darkness under the eyes. And then the personality of the patient also speaks to their constitution, so we would observe that. And then we're going to listen to the sound of their voice, maybe the tone of their footsteps, their voice quality, and if there's any odor coming from the body. In the ICU, where I've worked as a nurse, oftentimes with particular types of infections, there's a particular smell associated with that infection. So before the Chinese had all the technology that we do today, they had to use all of their senses to assess the patient. So smelling was also one that was utilized and is still utilized. And then there's an intake period where we would discuss family history, health history, any current complaints. These are sort of the vital signs of Chinese medicine. So asking about pain, appetite, thirst, sleep quality, and mood. These things sometimes aren't addressed in a Western medicine setting, but they're very important for a Chinese medicine diagnosis. And then we palpate the pulse. So we want to notice the texture and temperature of the skin. And we also might palpate the abdomen or along a channel to see if there's any irregularity in, say, the lung or large intestine channel. For the pulse diagnosis, it's in 3 positions on each hand, and these 3 positions represent organs in the body. So the lung is represented by the uppermost pulse on the right hand, and these are just the Zong organs here, so you won't see the large intestine represented. And then for the tongue diagnosis, which I would encourage you when you go home perhaps, or you can visit the restroom after the talk, take a look at your tongue and see what you might notice there. This is also an integral part of Chinese medicine diagnosis. So we notice the tongue body, the shape of it, if it's thin or if it's thick, if it's puffy or if it looks sort of deflated, the coating on the tongue, if it's white or yellow, that tells us if there's cold or heat in the body. And then sometimes there's things like teeth marks along the edge. All these things have different meaning. If there's red prickles on the tip, this would also be associated with something. But you can see that the intestines are there in the back portion of the tongue, where we often have a thicker coating. And the lungs are represented more toward the front. So some other TCM modalities are moxibustion, cupping, gua sha, tuina, and Tai Chi or Qigong, which we practiced together this morning. So the moxibustion is the burning of herbal leaves near the body, typically near acupuncture points. This is an herb called mugwort is the English name. It's we call it, or aiye is the Chinese name. And it's one of the only herbs that said that the heat goes down when it's burned rather than up with the smoke. So this is why the Chinese used it against the body to penetrate the tissue with heat. And then there's cupping. You may have seen there's a famous swimmer in the Olympics who had like purple circles on his back between heats, and this was due to the cupping. So we use fire to remove the oxygen to create a suction, and then put it on the body. And this is typically used for painful conditions, but also can be used for cold and flu on the upper back during this time of year. And it doesn't always have to leave those dark circles, but oftentimes there will be some marking, and that goes away with time. Gua sha is using a stone traditionally called bianshi, which is scraped along the skin. And you can see picture here, the top row, there's quite a lot of marking. This is called sha. This is the response that we want to see from the body. And then just 24 hours later, it's much reduced, and within 2 days, it's almost gone. But this can also have a good effect if there's tension in the neck and shoulders, and it can also be used for cold and flu symptoms on the upper back. Tui na is a type of Chinese medical massage. It literally means push and grab, tui na. And this isn't used as much in the United States, but more often in China. It's not your typical Swedish massage. It's used for medical purposes. And then Tai Chi and Qigong may be prescribed to you by your practitioner, certain exercises to strengthen your body based on what you're coming into the office with. And it's always good to have some sort of meditation practice or Qigong practice on your own. This just helps to settle the mind and often can relieve a lot of symptoms. There's also herbal medicine. So in Chinese medicine, there are over 400 single herbs, and those are combined in different ways to create over 200 herbal formulas, and it comes in different ways. So bulk herbs would be the raw herbs, like you see here in the picture. You would boil those to make a tea and then drink the tea. Granules have been processed already. It's just a tea that's been dehydrated into granules, and then you reconstitute it with hot water. And then tea pills look like tiny little BBs. They've also been processed already, and then you take them, many of them usually, to get the same dose as you would from a cup of tea, herbal tea. So now we'll talk some about the fall season and the metal element. So the autumn is a season of transition between the summer and the winter, or between the height of yang and the yin of winter. And so autumn is often called the little yin in Chinese. And then we discussed this earlier, but the metal element is generated by the earth element and then gives rise to the water element. And fire melts metal or controls metal, and then metal controls the wood element. So there's other associations with the metal element also. Again, with the color white, the direction west. The environment is typically dry. We've had some rain this fall, but typically the air is much drier in the fall, so it's important to stay hydrated. And you may notice that the nasal cavities are also dry. You can use some oil to moisten it if it gets too dry. The activity is the harvest season. The movement is down and in. So typically in the summertime we're very active, and in the wintertime we're usually more sedentary. So this fall transition is that movement down and in. Versus the springtime where the movement is up and out, just like the sprouts coming up from the ground. And the time of day that corresponds with the lung and large intestine of the metal element is from 3 to 7 a.m. So if you're one who often wakes at 3 or 3:30 in the morning, this would speak to some imbalance in those organs, and that's good information for your practitioner to have to direct a treatment. And also, so the lung is from 3 to 5, and then the large intestine is from 5 to 7. So for most people who have normal bowel habits, then they would have a bowel movement in the morning when they get up, and that's usually sometime around between 5 and 7 a.m. So we've spoken about this already, but the yin organ associated with metal is the lung, and the yang organ is the large intestine. The sense organ is our nose. The large intestine channel actually ends here, right by the nose. It starts by the nose and ends at the... starts at the finger and ends at the nose. This is large intestine 20. The skin is also the tissue that's associated with the metal element or the lung and large intestine. So we spoke earlier about inspiration from the heavens into the lungs as we take breaths in, and eliminating through the colon. So we also eliminate through our skin, right, by sweating. We eliminate through our lungs with our exhale, and we eliminate through our colon to eliminate the waste. So when the lungs are imbalanced, some conditions that we may see are asthma, allergies, trouble breathing, coughing that is either dry or with phlegm, immune conditions, or if you catch cold easily or you have a long time recovering from a cold or from COVID or pneumonia. Nasal discharge, we would pay attention to the color that's there. That also tells us if it's cold or heat related. Any sinus issues, skin diseases, because the skin's association with the metal element, and even things like sleep apnea, we would treat the lungs. So this is just the tissue of the skin. So if anyone suffers with eczema or psoriasis, this is the optimal time of year to treat those conditions, with it being associated with a metal element. And we've spoken also about grief and depression. So each of the organs has their own emotions, and these seasonal lectures, we talk about each one. So the fall season is a good time to be letting go of things that we've been holding on to, and letting our bodies to process the grief. The taste of the metal element is pungent or spicy. So some examples are things like scallions or onion. So you can think about when you smell a raw onion, how it really opens your sinuses. So these are related to the metal element, and can help to open up our lungs and large intestine. Our lungs, I should say. So the ancient Chinese believed that humans are a microcosm in the larger macrocosm, and that we're interconnected with nature and also subject to its forces. So we're impacted by our physical environment. So the balance between health and disease is a key concept, and the TCM treatment really seeks to restore this balance through treatment that's very specific to the individual, their constitution, the time of year that they're coming to us, and then the condition that's laid on top of that. So, some seasonal eating for autumn. Since the color of that's associated with metal is white, things that are white are going to tonify the metal element of the lung and large intestine. But that does not include white flour or white sugar. These are processed artificially white. So vegetables that are naturally white, like cauliflower or parsnip, fruits like winter melon, where the flesh is more white, or pears are an excellent example of something that's very nourishing for our lungs, especially if we have a dry cough. We can core the pear and put some ginger inside and then steam it or bake it and then eat that pear. Will help to nourish the lung yin, what we call it, the fluids in the lungs, so that we can treat a dry cough that way. Some legumes, for example, would be white beans, oats in the grain category, and spices like garlic, and nuts like cashews because of their lighter color. And again, the Asian pear is really best. It's less sweet than the Bosc or American pears, and you can find those in most grocery stores. And they're also more round, right? So you can core out the center, put the ginger inside, steam it, or if you don't have a way to steam it, just bake it. But that sort of makes it too hot. The steaming really infuses more moisture into the pear rather than dehydrating it. So if you're able to steam it, that's best. And then actually eating the pear to help nourish the lung yin to treat a dry cough. So some tips for preventing overeating. I thought this cartoon was cute. Acupuncture is really helping control my appetite. So it's important to stay hydrated. The air in the autumn season is very dry. And oftentimes when we think we're hungry, we're actually thirsty. So staying hydrated with warm fluids, perhaps eating a piece of whole fruit about half an hour before your meal. This will also increase your satiety, and you would be prone to eating less at the meal. And really slowing things down and eating mindfully. I think oftentimes in today's culture we're rushing, we're eating on the go, we grab something, we're eating it as we're on our way in the car somewhere else. But really sitting down at the table, maybe with loved ones around, and paying attention to the way that the food looks and how it smells and the texture in our mouth, and really taking some time to be mindful with the food. And we would find that we get full faster when we slow down. And also just stopping when you're about 80% full is a good technique to not overeat. Some self-care for fall. So again, the autumn is the harvest time of the year, and it's an excellent time to reflect on the year past and harvest any lessons that we may have gained during that time, and process any memories or emotions that are remaining. So the metal is associated with a reckoning and there's an opportunity in the fall season to be more discerning and have new inspiration come in. So take some time to journal, write things out. That's one way that we can release and let go of things, is by putting it down on paper. And handwriting is often more effective than typing as a way of release. It's more physical. So the healing sound associated with the metal element and the fall season is. So one other Tai Chi movement that you could do is, we did the tapping earlier.
Down the lung and up. And one thing that we didn't do, but you could do, is some gentle, soft fist tapping on the chest, and then stroking from the armpit where there's a lymph nodule there, down the side, and also tapping to activate, to loosen the lungs, any phlegm that's in the lungs, like this. And then taking a deep breath in, crossing the arms and pushing here where that lung 1 and lung 2 are, and making that sound. Maybe we can try that together. Do you all want to stand? I think we have time. Yeah. Let's do first just a little tapping on the upper chest, or even down on the ribs, the lower ribs. Just some tapping, gentle tapping. This helps to loosen up anything that's stuck inside. And then we'll rub from the armpit down to the bottom of the ribs, and open hand, pat. Open hand with a cupped hand, pat. One more time. And then we'll do the other side, rubbing from the lung down to the ribs, and then pat. We'll go down 3 times, pat. Great. This really helps to loosen anything up. And then we're going to take a deep breath in and cross our arms, and we're going to tap with like a little beak here, and we're going to say, we're lean forward a little. So we'll do that 3 times. So in, cross. This is really activating the lung channel and releasing. One more time, in. Great. And we won't do it here, but if you were home, you could end that with a good cough to see what might come up. So just taking a moment now to notice what you feel in your body. Maybe you're more aware of this area that we were just tapping. Maybe your lungs feel more open, like you can take deeper breaths perhaps. Great. So this is something that you can do throughout the fall season to help loosen and eliminate toxins or phlegm from the lung area to support your immune system. So colds and flus are fed by sugar in our diet. Bacteria lives on sugar, so having less sugary foods will help to keep our immune system toned up, and we won't be feeding the unhealthy bacteria. Drinking warm fluids, again, because the autumn season is dry, we want to have more fluids, and warm fluids help to loosen and lubricate. Doing the Tai Chi or Qigong exercises for the lung that we practiced this morning, and also this one with the healing sound. And then the last self-care that you could do for cold or flu is some acupressure. So these are immune boosting points for acupressure. So the first one is called stomach 36. And you can stay seated, it'll probably be easier. But if you use your hand, on the top is just below the kneecap. You can leave it on the ground. I've just and measure 1 hand width below your kneecap and 1 inch from the tibia here to the right. That is stomach 36. If you press it, you may find that there's a little bit of tenderness there, perhaps, not for everyone, and that's how you know you're in the right spot. So this is a great point to massage that improve your immunity. And it will be the same on both sides. So you would do the same 1 hand width and 1 inch laterally, and that's stomach 36. It's on the stomach channel, but we know that our guts hold so much of the microbiome is there, and that really impacts our immune system. So this point on the stomach channel
will help with your immunity. There's also an area on the bottom of the foot. You can see in this photo here, the gray area along the ball of the foot. You can rub, and that represents the lung. So you can perform these types of acupressure for yourself, both to keep yourself healthy through this cold and flu season, or also to help to decrease the severity of illness, or to speed up your recovery if you do end up getting the sniffles. These are some other acupressure for nasal congestion. As I mentioned, the large intestine channel ends here by the nose, but any of these areas between the eyes, the inside portion of the eyebrow, all of this you can just massage gently, especially for nasal congestion, to loosen things up. And also along the pointer finger here, the first point here is between the thumb and forefinger. This point is like the master point for any condition in the head. So if we're congested or we have a headache, then this is a great point to massage. It's called hugu, large intestine 4. But you can also massage these other points along the large intestine channel there, toward the tip of the first finger, and that can help with nasal congestion. So just taking a mental snapshot, you can see in this, the picture on the left here, it's a little hard to see, but there's some red dots along the side of the head. So if you open up your 5 fingers and put them on the side of the head, this is the gallbladder channel, but it also helps to eliminate what's considered wind in the body, which is related with this nasal congestion. You can just give it a little rub. This helps to loosen the sinuses, and you can get more drainage. So this is an image of the 2 lung and large intestine meridians that we've been speaking about today. You can see that the lung channel starts here below the clavicle, where we did a lot of that Tai Chi work, and goes down to the thumb. And the large intestine starts at the tip of the first finger and winds its way up the shoulder to the neck and then to the side of the nose. So each change in season can be very challenging for our immune systems. And that's evidenced by people getting sick when there's these changes in the weather, right? When it goes from hot to cold suddenly, or there's, a windy time, patients get colds very easily. So it's a good time to consider Chinese medicine or acupuncture and herbs to balance and brace up your immune system, and also address any imbalances in your system. If you get a head cold or a virus, there's also formulas that can be very effective for treating the symptoms and shortening the duration of your illness. These are just a few references that I used for my presentation today. And there is now time for questions. So you can, if you want to follow up with me afterwards, my website is there, also my office number. And these are the specialties that I treat. However, I do treat most anything, but cardiovascular conditions, psycho-emotional or stress-related illnesses. That includes autoimmune disease. And then 2 masters I trained with in China, one who did pediatric tuina, and also another master that taught me about scalp acupuncture. And I wonder if there are any questions I can answer about the presentation today. No? Okay, well, thank you so much for your time. I'll be around. If you want to ask a question in private, or if you'd like to follow up, I do offer complimentary 15-minute virtual consultations if you want to speak over like a telehealth appointment, and we can talk about your concerns in that way, and then I'd let you know what sort of treatment plan I might recommend. Okay, thank you so much.